Hello, everybody. Welcome back. Happy March to everyone. Weather's starting to maybe flip a little bit and not quite as much, not quite as much winter stuff,
Yeah,
right, Maggie?
right. Fingers crossed.
Yeah, which that always makes us excited around here in central Pennsylvania.
Yeah.
So we are doing our second episode on macros and micros,
hmm
a combined collaborative approach of chiropractic and functional medicine concepts. Our topic this month is protein. So I am Dr. Emery Pitcel. I am the owner of Rothrock Chiropractic and Rehabilitation.
Cool. I'm Dr. Maggie Sopic. I'm the owner and chiropractor and functional medicine provider at Recenter Chiropractic Wellness and Functional Medicine. That is a mouthful.
Yes, but it's also reflective of all the things that you do at your
Oh,
practice.
yeah,
So
likewise.
you gotta have that in the name, right?
Yeah.
Yeah, rehabilitation is not a word that I try to say 5 times too fast either. So,
Yeah.
all right, but let's jump right into the content. Like we said,
Yeah.
protein was what we were going to talk about. We kind of felt, hey, we're coming out of the winter months and everything like that, and I know some people are sort of thinking about like, okay, now that I'm coming out of winter, it's maybe a good idea to maybe try to drop some of those winter pounds. Well, to do that correctly, you gotta be managing your protein intake
Mhm.
correctly. You feel that same way, Dr. Maggie?
Absolutely. Yeah.
Yeah, yeah. So let's talk a little bit about what protein is from a very quick biochemistry. Now, this isn't going to be like a super in-depth
Yeah.
coverage. If you want that, go to university and register for a biochemistry course. They'll beat you
Yeah.
over the head with this information. But
Yeah.
basically, what proteins are is that they are chains of amino acids. And what every amino acid is basically a backbone that has a nitrogen and two carbons, and then off of one of those carbon chains you have other types of chemical properties, and that's actually what makes all the amino acids differently. There are 20 different amino acids, and we'll get a little bit more into this later because it's important later in our
hmm
topic, but 9 of them are classified as essential. So non-essential amino acids are amino acids that your body can actually synthesize and make itself. The essential amino acids actually need to come from your diet because your body cannot make 9 of them. And so you're eating protein, and as you eat it, there are these chains of amino acids. We start first with our digestion by you got to slow down and take your time to chew your food.
Yeah.
If grandma told you that, she wasn't saying that to be petty. It's really true. Digestion always starts in the mouth. Breaking it down into smaller, more manageable pieces is actually going to be easier on your digestive tract. Then a lot of these amino acids start getting broken down in the stomach. We have like a lot of hydrochloric acid, which will then
hmm
denature and break apart, that open up kind of that amino acid structure. So then that way the pepsins and other types of protein enzymes are able to get to it and start to snip up that amino acids. Then the pancreas is also really responsible for releasing a lot of enzymes as well too, that further breaks down these proteins. So that way it could then be absorbed in the small intestine. And generally at that point when it's going through the small intestine, most of those amino acids are either one amino acid, two, or three. So what we call dipeptides or tripeptides. So that's kind of how
Yeah.
the whole process goes. If you take nothing more of that from anything than from that, it's slow down and chew your food, right? So that
Yeah.
way your body can do everything at the stomach, pancreas, and small intestine the way it's actually supposed to do it, right?
Right. And I think reiterate that to just about every single patient because we do live in a life of like rushing, hurrying, but no
Yeah.
matter what, like it is a hard thing to implement, but we need to chew your food until it's like an applesauce like consistency.
Mm-hmm.
So then swallow, then get ready for your next bite. I also need to take this advice too.
Yeah, yeah. And then, maybe you've heard other people say it, but it's true. When you are able to like slow down, that's also going to prevent you from overeating, because then you actually give enough time for that distension at the stomach and that
hmm
communication back to your brain to actually send that signal of satiety and
Yep.
we're full. And that'll just also further help you for maybe trying to get some of those winter lbs off,
Yeah.
right?
Yeah.
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 So, Dr. Maggie, could you take this next one? Why is protein so important for us, and what
Yeah.
are some of the big functions in the body as far as the importance of needing
Yeah,
protein?
there's a plethora, and I won't get too far into the weeds. And I think I want to say that it's mostly understood that protein is very helpful for muscle building, and that we need that, and for muscle repair and recovery. And in that same aspect, connective tissue, especially
Mhm.
with our and with joint health, with our collagen. So even like one example, especially, if there has been a damage to, like, say, hair, or we're having issues with even maybe hair growth, a simple way to see if it could be your protein intake is just slightly increasing it. Just an
Mm.
example of that connective tissue and collagen like structure. But obviously with that too comes in bone density.
Yeah,
Especially we can, attach that to our aging process too. Um, Other ones that may not, we may not intuitively think of is protein's very important for our nervous system, for neurotransmitters, for those like signals, the like happy hormones, basically for focusing, for stress resilience. And honestly, in the like functional space, we'll say, but it also comes through to our like chiropractic, like manual care, is a lot of blood sugar balancing, which is, I feel like, very in the highlight of social media, which is a good thing, but just it's coming more to light of the importance of blood sugar balancing. Um, Also, you kind of mentioned with, digestion, that it's very helpful for our gut integrity and the actual lumen of our gut, to
absolutely.
make
Yeah.
sure that that's strong. So yeah, there's a plethora of functions and importance for protein.
Yeah, yeah. And I think your list was pretty good, but I have a little bit of
Go
list here, and
on.
I know there's
Yeah.
some that you missed, and I want to make sure they're
Yes,
highlighted as well too.
please.
You kind of already alluded to like the joint and the bone and the muscle health. Like, yeah, absolutely huge for recovery after physical stress. You don't even
Mhm.
need to just be an athlete to need that
No,
proper
yeah,
recovery. Like
absolutely.
we have wear and tear every single day on our bodies, and we need to be able to heal that.
Mhm.
Yeah, and you kind of already said like, that's a big metabolism boost, so that's actually
Mhm.
going to shift your body into a state where it's more readily to access and burn fat instead of
Mhm.
going
Yeah.
after the muscles. Because if you don't kind of put that protein back into the tank, then your body's going to actually start to more readily first tap kind of like the simple carb and
Yep.
like the glycogens, then it'll
Yep.
go after muscle before it goes after fat. But if you're helping to put that protein back in, then you're going to actually access more of your fats for energy.
Right.
Yeah, love that you said the blood pressure spike. I had that on there is really important too. So for our like our diabetic management, protein is a huge piece of that puzzle.
Absolutely. Yeah.
And then also just something to note too. Again, spring, we're gonna have like these allergies. We're gonna have these
Yes.
sicknesses pop
Mm.
up. A lot of those proteins make up a lot of the immune cells for
Mhm.
us, and like literally antibodies are basically all protein
Yep.
chains. Like
Yep.
that's pretty much
Great
most
point.
of what they are.
Yeah.
And huge on balancing mood as well too. That's kind of your neurotransmitters that you were just talking about.
Mhm.
Just backing you up on that and saying,
Yeah.
yep, that's a big piece of it as well too.
Oh my gosh, yeah. Yeah,
Any
there's a
Now that I have that conversation, is there
yeah.
anything else that you're that's
Oh,
popping up in your
yes.
head that you might want
Yes.
to add to?
I had another note, but um,
Yes.
kind of, I guess, still on the same lines of immune function and just overall, I mean, just, yeah, overall health function is inflammation control.
Yes. Yeah, for sure.
So when there is an inflammatory response going on, we do want to make sure that we are getting your individualized, like, adequate amount of protein to really help either decrease that inflammation, whatever, you know, may be causing that. So overall, yeah, it does make a big, or plays a big role with inflammatory control.
Absolutely.
Yeah.
And us being chiros that also focus on manual therapy and physical medicine side of things, right? If you can't have full control of that inflammation, we can give you the best McKenzie exercises in the universe. We can give you the
Hmm.
best like rehab, do the world's best adjustment. If you don't have control over your inflammatory process, it doesn't matter. You're still going to hurt,
Yeah.
right?
Yep. Yep.
Yeah. Yeah.
Yeah. Absolutely.
We were talking a little bit ahead of time, right? That not a lot of people are technically deficient in protein.
Hmm.
And we'll get more into the how much later because I know there was a very enlightening
Yeah.
conversation that we had along those
Yeah.
lines. But talk me through, if you can here, talk me through some of the if we do get deficient in
Mm-hmm.
proteins, what are some of the warning signs that your body will send up as like
Mm-hmm.
yellow and red flags to say we've got a problem?
Right. And they're basically the opposite of what we just said the benefits are.
Very
So,
true.
what you may be seeing is you may notice like muscle wasting. You could see poor sleep, poor moods. You could see a little bit more of a higher percentage of body fat, potentially
Hmm.
dependent on, yeah, what your body is needing. Um, I kind of mentioned the hair. I don't know why I'm like really picking on that. I think I
Hair,
see a
nails,
lot.
skin,
Yeah,
right?
I see a lot. Of course, like that
Hmm.
is a part of like women and men really, dive into the aesthetics. And so when we're looking at, yeah, our nail and hair, all connective tissue and muscle integrity. So we may see with deficiencies, we may see an issue in that area. Um, Decreased immune function.
Yep.
Um, yeah, I think, and I don't know if I already mentioned this, but yeah, blood sugar imbalances where we have those like major slumps, like you hear the afternoon slump, and it could potentially be a protein deficiency or just not enough for that individual.
Yeah, yeah. Or it's at least part of the story,
Oh yeah, and
right?
there it is
Yeah.
so multifactorial. So like yeah,
Always. Always, always. But like, yeah, you got to chip it one
yeah,
piece at a time.
yeah,
We can't. If we as practitioners tell people change these 20 things at once, you'll get people to maybe change three. So you got to
yeah,
peel it back layer by layer and
yep,
make those fundamental changes, right?
right,
I think the only thing that would also be really great to add on
yeah,
kind of like this deficiency conversation is we were talking ahead of time about there are so many advantages to being vegetarian and vegan. There
mm,
really is. But vegan is not something that you want to just willy nilly jump into and make that decision. It actually
mm-hmm,
requires being very strategic about being comprehensive and very diverse with where you get your plant source protein from,
right,
because the easiest, now this is where those 9 essential amino acids plug directly back in from the
yeah,
intro. Since your body can't make 9 of the amino acids, the easiest one to actually get deficient in for an amino acid for a plant-based diet is lysine. So this amino acid that's called lysine, because what a lot of vegan diets are is they're very high in kind of like grains and a nice variety of like oats and
mm-hmm,
barleys
mm-hmm,
and quinoa and all these amazing great things, but those are good foods, but they really have like no lysine in them.
right.
So that's where it's really important to just like be able to educate and talk patients through. It's like, great, let's do
Yeah.
this, but let's make sure that you are getting like legumes and nuts into your
Yep.
diet, because that's important, because that's going to plug back in the lysine. Now, maybe the legumes aren't as good about getting methionine in, but the grains really cover that
Right.
realm really well. So the short skinny of it is that, like, if you're going to make this decision, that's great, we support you, there are so many
Yeah.
health benefits to doing that, but you got to do it in a responsible way, and you have to be a little more strategic to make sure you don't accidentally give yourself an amino acid deficiency, because you'll pay for it in your health downstream from that,
Right.
with a lot of the things that you just said there, right?
Right. Right.
um, and then it's not super, of course, common for people to maybe, or I should rephrase this. Yeah, some people are probably overdoing protein and getting too much, but for most people, as we were having a conversation ahead of time, most people aren't going to typically overdo it to get to like the scarier kind of
Yeah.
like protein toxicity levels.
Right.
But do you want to talk through like what some of the overdoing concerns are?
Yeah. The biggest one obviously is just like with your kidney function, and so it
100%. Yep.
can if you're overdoing it. And again, this is so individualized. So if there is a predisposed issue with your kidneys, whether it be lupus, and we kind of talked about some of these conditions, but if there's issues with even blood pressure, but we do want to make sure just getting a sense of how much we are getting in, because then that can also, and I guess I'll interrupt myself here, but when we do say either increase or we become more aware of our protein intake, I highly advise to make sure you're getting enough water intake with this.
Absolutely.
Same deal with
Yes.
fiber too, but that's a topic for another day. But we do want to make sure that we're getting enough water so that we, again, like we can filter this a little bit easier through our kidneys and we don't have that dehydration. So
Yeah.
overall, yeah, we want to just, yeah,
Yeah.
be advised on that.
What more people are going to see, though, that the kidneys, I think, are the boogeyman that gets picked on a lot
Yeah.
about, like, don't overdo protein because you'll trash your kidneys. Okay. For most people, let's say, like, most people that are under the age of, like, 60 or 70,
Hmm.
sure, you want to be concerned about it, but realistically, that's kind of like an overblown concern.
Yeah.
Unless, like you said, lupus, polycystic kidney disease, diabetes
Hmm.
type 1 or 2, hypertensive, right? Then, yeah,
Right.
let's have a serious conversation about making sure that we are not going way, 10s, 20s, 30s grams
Yeah.
more protein a day than you need.
Right.
But for the most part, what more of the symptoms are going to be is like if you overdo it, you're going to have more like bloating, gastral distress,
Hmm.
gas, diarrhea, which are still not pleasant, but not as
Right.
terrifying as I'm destroying my kidneys,
Right.
right?
Absolutely.
Yeah,
Yeah. And
yeah,
that's, yeah, no sense of being like fear mongering in that, but that is like the extreme. But you're right. Exactly. Like if you're having too much, you may have some, yeah, just overall abdominal discomfort
yeah.
and notice more things digestive wise.
Right.
Yeah.
Yeah. Now, perfect segue. How
Yeah.
much protein are we supposed to get, Dr. Maggie?
Okay, so I feel like everyone gets a little feisty on this one. So
Yeah, but like open the
yes,
floodgates.
here
Let's do it.
this we're opening the floor for the conversation. So currently RDA guidelines are
Mhm.
stating that adults need zero point 0.8 grams of protein per kilogram of body weight. So what the heck does that even mean?
Yeah.
So if you weigh 150 pounds, it would translate to about 55 grams of protein per day.
Yeah, because you got to take your weight in pounds divided by 2.2, then multiply by zero point 0.8
Right.
for the math majors
Yeah,
out there.
if you wanna put that in the comments, we'll add that.
Sure.
Um, I have my own, like, seeing this in practice, and again, we are doctors, but we may not be your doctor, so please talk to someone if if this is a question. But typically, that is not enough for who the conditions that we're seeing, that I'm seeing. It's just not. And so what I have found is that these guidelines are more so for avoiding malnutrition rather
Yes.
than getting to that optimal function of all of the benefits that we discussed previously.
Hmm.
So then what does that mean? And so we may want to just, again, this is where it's very individualized, but you may want to at least increase that to maybe 1 gram of protein per kilogram and whatnot. And so it may reach up to about like 90 grams per day average for that 150-pound person.
Yep.
But that is also not to say like we don't want to just like, okay, go from say 50 grams a day to 90 the next day, because that's not going to be fun at all for how we just mentioned with all of the digestive,
Bloating, gas, and diarrhea.
yeah,
Yay.
not fun at all. So you want to slowly integrate that, again, dependent on your movement, your conditions. There's just so many factors that do, determine maybe how much you should be getting.
Exactly.
Went on a tangent there. So thank you for
No,
your
no, but
time.
that was really perfect. That was really, I think, a good comprehensive discussion on the how much. For those that didn't watch last month when we talked about vitamin D, it was that same conversation where it's like
Right.
that number is actually low. It's kind of the number that they said is meant to keep you away from like severe deficiency, but is
Right.
that really the right amount to have optimal wellness?
Mm-hmm.
And a lot of these RDAs, it seems like they're just kind of set at the avoiding like the cliff versus okay, if you really want to feel the best version of yourself,
Yeah.
that number actually has to be higher,
Right.
right?
Mm-hmm.
And then water with it, right? If you're going up
Yeah.
with that protein, I guess we
Yes.
practice what we preach here, right?
Yeah. Right on.
Yeah. So we're saying maybe more like 1 gram per 1 kilogram of your mass. So I'm going to go over where we should try to get a
Yeah.
lot of that protein. Food. It comes from your food. Let
Yeah.
thy food be thy medicine,
Yeah.
right? I'm going to give you some numbers. This is by no means a comprehensive list. If you have a couple other ones that you want to
Sure.
chime in with, Doc, feel free to add. but one large egg gives you 6 grams of protein, right?
Mm-hmm.
And then if you get like a 90-10 lean beef, you're getting about 22 grams per 3 ounces. Maybe to make the math a little simpler, because I know people kind of like the quarter pound burger idea. The quarter
Mm-hmm.
pound burger is going to
Yeah.
give you like 28 grams of protein, 28, 29, right?
Yeah.
So that's getting you fairly close to like that 90. It's putting a big
Yeah.
little lump on it. Chicken breast is 27 gram per about a 3 ounce serving. Um, Now, a lot of the stuff I just picked, those were meats. We had a discussion about like, okay, hey, what about the people that are like a bit more vegetarian
Right.
or the vegans that are not going to eat anything animal source, right? Here's some stats for you. Lentils, if we have a 50-gram serving of lentils, that'll give you 12 grams of protein. Tofu, we like tofu in our house. So I don't know
Mm-hmm.
about you, but it's nice to have like at least once a month. 20 grams per about 1 cup of tofu. Chickpeas are fantastic, so versatile to like
Mm-hmm.
make hummus or to like we like doing like chickpea shawarma, for example, instead of doing like a
Yes,
chicken
that
shawarma,
is good.
Mediterranean diet idea, but 21 grams per about 100 grams of those chickpeas. And then walnuts, just to kind of pick one of the nut
Mm-hmm.
family there. We're looking at about 4.5 grams per ounce there. So you try to string all these various different protein sources throughout the day, like between your meats. It is nice to get a variety of
Yeah.
just meat base and plant base. You don't want to try to just get all your protein
Mm-hmm.
from meat only. That's maybe not going to plug directly into this conversation, but it's
Yeah.
going to definitely fit into other macros and micros conversations
Yeah.
about why you don't want everything to be meat. Because meat is great, but meat doesn't have dietary fiber, for example, right?
Right. Yeah.
But like you said, different conversation for a different day.
Yeah.
Do you have any other kind of
You
like
know,
suggestions or ideas, or maybe any ideas about like when should maybe somebody think about like supplementing with like a powder of some sort or
right.
anything?
Yeah. Yeah. And I feel like that conversation, carnivore dieters are gonna like hate on this, but um,
Oh,
no. But there's a couple things that can kind of add a little bit more protein too. Is nutritional yeast, and
oh yeah,
I don't
right.
know if I yeah, wait. Yeah, it's 5 grams of protein per 2 tablespoons. So that is, I mean, it is a plant-based protein, and so sometimes like there are different recipes for like a non-dairy like cashew or like a cheese. It gives a little bit of a cheesy
Mm,
feel,
yeah, yeah,
but it's
yeah.
a good protein source. When we're talking about protein powders, my philosophy is getting as much as we can from food because
Yeah.
there's just so many benefits to whole foods. But if you are realizing that like it can be difficult, it can definitely be difficult to make sure that we're getting all of our protein.
Yeah, yeah, right.
So it may be a time frame that you do want to introduce a protein powder, and there are about 1,000 on the market.
Yeah.
So this is where, I mean, I'm not going to spout out a million different brands, but definitely you'll want to do your research because there are a lot of powders that have quite a bit of like fillers and some not really great ingredients.
Yeah.
So, kind of narrowing it down and honestly taking your time to do your due diligence on that ingredient list, or just talk to a provider, whoever that may be, on maybe some good brands or examples for you.
Yeah. Yeah. Or talk to this person, right?
Sure, yeah, let me know.
Yeah, yeah.
Yeah,
This jumps probably kind of in, and I know we tipped our toe a little bit into it,
yeah,
but how about like the solutions base? So if somebody is
yeah,
coming to you and they say like, okay, I want to work more on the functional medicine side of my
yeah.
health, and you start to kind of get to the conclusion of like, okay, we're going to do some stuff with protein. Maybe
Hmm.
just kind of talk people, pull the curtain back a little bit, and kind of talk people what that process looks like at your office.
Yeah. So the first part of this is what people don't like to do is become aware of how much they're taking in a day.
Yeah.
And this is where, I mean, there's some, I don't know, thoughts as far as macro counting, but this is just more of an awareness time. So I typically recommend someone to maybe take like 2 days or 3 days of just either they can take a picture of their food and we can go over like how much maybe that is like in a meal, or they take pictures throughout the day, or they can get as fancy as getting a food scale and actually like diving into this and writing it down and tracking.
Yeah.
Awareness is going to be number one.
Okay.
And then, based on maybe where they're at and what their needs may be, if we're seeing some of these like deficiencies, is potentially, and most of the time, is increasing it, but
Hmm.
not increasing it just at one meal. It may be, say for breakfast, a very common thing I see is someone may just have two eggs. And sometimes that's just not, most of the time it's not enough, so we can add some other sources. Maybe you want to add, if you want to have toast with it, and then we can add some like hemp seeds over it, some avocado, and so that we're just actually getting a little bit more variety in our diet, and
Yes.
we're slowly enhancing that protein as well. But there's, I mean, that's just one example though too, and
Hmm.
so there's just different incorporations as well.
Yeah.
Yeah.
Yeah. And then I think part of my ignorance on this, but
Okay.
unlike something like vitamin D and other kind of like micro and
Hmm.
vitamins and those types of things, there's not really like a specific lab work test to tell someone if they're deficient in protein, right? Not
Yeah,
necessarily, right?
not necessarily. I wouldn't say there's like in our blood we can test obviously protein and
Sure, yeah.
globulin and albumin,
Hmm.
or if we do like like test if there's protein in the urine.
True.
So we can see that, and most of the time, um, it's not always that it's like, oh, that's a clear. There's just a lot of variables, but
Yeah, yeah.
there's
And
not
I think
always
that's
a
the
clear.
problem with that is
Yeah.
that doesn't tell you that that's a protein deficiency or a protein max. It could be
Right.
something else that's doing that.
Well, and you earlier, again, not to go on a tangent, but obviously our digestive function is very important. And we kind of touched on this with vitamin D, but we need to make sure that we're having enough stomach acid, that we have like
Mm.
efficient amount of these enzymes in our uh, in our pancreas, small intestine, to make sure we are absorbing these proteins. So if we have,
Yeah, good point. Yep.
if we are on, say, like a proton pump inhibitor, or just there are various medications and whatever that implement or
Hmm.
halt some of these enzymes. We just want to be aware of that too.
Yeah, yeah, good point, good point. The other thing I want to chime in on solutions is very much like what we talked about last time, right?
Hmm.
So we already said one of the important functions of protein here, right, is that muscle building, that proper bone density, the proper integrity and health at uh, the the joint itself, neurotransmitters to make sure neurological function is actually where it needs to be.
Yeah.
All of that is important. So if we are doing treatment and we say like, hey, 4 to 6 office visits because we think you've got like a sprain strain or a disc or a nerve entrapment that needs to be
Hmm.
rehabbed, and that's what we really hit really hard with our functional rehab on this side,
Yeah.
the high quality muscle therapies, the manipulations. When indicated, most people we will just because they're coming to see a chiropractor. They want to hear things move,
Yeah.
right?
Yeah.
But if we're not seeing the results that we want to see, and then we start to think to ourselves, like, again, this could be something that's actually an internal medicine. We're really good, I say, at my practice of
Hmm.
healing people from the outside in. But when it comes from an inside out healing perspective, that's where
Hmm.
I love talking with Dr. Maggie and making sure that she's part of my collaborative team, is because
Nice.
that's when we need to pull in some of that and really think about that.
Hmm.
But again, the door swings both ways. So
Exactly.
like
Yep.
if Dr. Maggie feels like, hey, you've gotten your protein levels really well, you're eating the way that you need to, and you're still maybe struggling with something with a pain wise, maybe it really is then a mechanical problem. Maybe it
Right.
is a disc lesion that actually really needs to be worked on with a McKenzie perspective and with some really good manual therapy at our office.
Yep.
And that's where the referral process
Yep.
goes as a two-way street in
Yeah.
this. Um, but just really important to say that, like, I think at both of our offices, we don't just treat and say, like, oh, well, it's not getting better, let's keep treating. Because the definition of
Yeah.
insanity is trying the same thing over and over and
Hmm.
expecting a different result, right?
Yeah.
If we don't get that, then it's you got to ask those questions about why isn't this changing? Is this now a mechanical problem? Or,
Right.
hey, is this like a functional medicine, internal medicine thing that we need to bring up to speed so that way you can actually
Hmm.
feel the way that you're supposed to?
Right
And
on.
it takes teamwork, I think, to do it the right way.
Yeah,
And
agreed.
that's why we try to work together.
Yeah, right on. Love it.
30,000-foot view.
Yep. Yeah.
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 Is there anything else you feel like we need to chime in on protein? Because I feel like we were pretty comprehensive. I mean, of
Yeah.
course, we didn't touch on everything because even in
Right.
30 minutes, we still can't talk about everything.
Yeah.
But I'd like to think we did a pretty good overview
Yeah.
and really kind of walked through the background of it, the biochemistry, actually how it ties in clinically and functionally to your everyday life and everything. So hopefully this was helpful for everybody.
Yeah, I hope so too. Yeah, and like we kind of mentioned, we weren't never want to deem a diet approach or nutritional plan good or bad. Everyone's so individualized, and so if you do have questions, work with someone like one of us that just has a little bit more insight to your care.
For sure.
Yeah.
So, well, from our macros and micros, we're going to close out for March of this year, March of
Yeah.
2025, right? I'm Dr. Emery Pitcel of Rothrock Chiropractic Rehabilitation.
And I'm Dr. Maggie Sopic of Recenter Chiropractic and Functional Medicine.
Yeah, please join us back in April. We'll have another topic to go over with you, and we're excited to continue to educate and share valuable information with you. Thank you so much for joining us all. Like, comment, subscribe if you found this video helpful. Share it with a friend so they could be empowered and learn more too.
Yeah. Thanks.
Thank you. Take care, everybody.